Hello, welcome to Healthy Happy Families with a Natural Parent. I'm Annaliese Jones, naturopath and medical herbalist. Today we're answering a question, which is what can we do for sore muscles? We're going to answer that, and also it's brought up some other really common things that I see here in the clinic, which actually just this past week I've had more than 2 clients say they feel broken after pregnancy and birth. Like, they all used that word, just feel broken. Some of that is mental, emotional, and exhaustion. And for some of these women, it was also about their body just not feeling the same as pre-pregnancy. Starting with muscle soreness, let's just start with that. So when we're pregnant and also post-birth, once we've been cleared to exercise, stretching is so important. And I would really recommend when you're pregnant, if you've got sore muscles, to make sure that that doesn't stop you from moving your body, and specifically that you stretch as often as you can. So if you don't have any complications, you can probably just do this on your own at home, some gentle stretching. If you feel you need some professional advice about it, I would see someone who specializes in pregnancy physio or Pilates or yoga, and I would get some advice around what's the best way to relieve your soreness that you're experiencing. As far as things that you should take, the safest, easiest thing to take is magnesium. We want to start at a lower dose of around 100 milligrams and just see where our bowel tolerance is. We probably don't want to be taking more than 300 milligrams in pregnancy. And be careful that you're not taking it with some other things. So quite often some of these magnesiums will come with, cramp bark or some other things that perhaps are not really appropriate in pregnancy. And sometimes in breastfeeding as well. So just watch that it's a magnesium on its own or that it's specific for pregnancy as well. But magnesium is very important for the relaxation of muscles. Calcium is the contractile mineral within a muscle spindle, the little things that make up our muscles. So that's, they work together, those 2 minerals, magnesium and calcium, and we tend to get a little low in magnesium, which means that the relaxant part of that action doesn't happen particularly well, and we end up getting quite tense and tight. Obviously in pregnancy there's lots of reasons for that. We're carrying a lot of extra load. We can also, with the progesterone that's higher in our body, we can end up having some issues with our joints actually getting looser, and that can cause a lot of problems for people, particularly around the pelvic girdle and around their sacral area, and also right at the front where your hip bones meet. It's called the pubis in there. So sometimes that can come apart a little bit and cause an awful lot of pain. So much so that some women end up on crutches actually during pregnancy. In those cases, you really do need to seek out some professional help. There's all sorts of things that can be done. If there's any arthritis playing up for you in pregnancy or post-birth as well, then I would definitely recommend reducing down your exposure to the Nightshade family. Now, this is not for necessarily everybody, but I would definitely recommend that you give it a trial. And when I say trial, I'd say 2 weeks. So the Nightshade family of foods can exacerbate any inflammation in joints for some people, not everybody, but honestly, it's worth a try because some people just find it a miracle cure. So the Nightshade family, mostly the most important ones to avoid are your potatoes, tomatoes, capsicum, and aubergine. And so just make sure that just have a break from them completely for 2 weeks, and see how that goes. Obviously, for people that are not having joint issues, don't avoid those foods. They're very healthy. It's just for if you've got some arthritic pain. Post-birth, of course, there's all sorts of things that create an extra burden on our musculoskeletal system. And of course, it's picking up, constantly holding little ones, bending over a lot, the breastfeeding position, co-sleeping, there's not being able to move our body post C-sections possibly, that sort of thing. So we need to give our body time to heal when it's something like, say, post C-section or even post-vaginal delivery. We really do need to make sure that we're not overdoing it. Give your body that 6 weeks before you actually start to do some exercise. The really important thing for aiding soft tissue recovery and healing is actually protein. So make sure that if you eat meat, that you are having red meat, chicken, fish. If you don't, that you're having legumes, eggs, nuts and seeds, that you're getting plenty of protein in, so that you can kind of like knit back that connective tissue and get that soft tissue healing happening as well. That's really important. Most of all, seek help if something doesn't feel right. That's really, really important. So go well. If you've got any questions, just DM me, and I hope you have a really wonderful day.